How does patient privacy for cosmetic procedures vary worldwide? Imagine getting a cosmetic procedure abroad and wondering how your personal information is protected. Patient privacy in cosmetic surgery can differ a lot depending on where you are. Laws, cultural norms, and healthcare practices all play a role in how your privacy is handled. While protecting patient information is a universal goal, the specifics can vary widely from country to country. In the United States, privacy is mainly protected by the Health Insurance Portability and Accountability Act, or HIPAA. This law sets strict rules for how medical information, including photos and personal details, must be handled. Surgeons need to get written consent before taking or sharing images that could reveal your identity. If they don't, they could face legal trouble. However, not everyone follows these rules perfectly, and some might only get oral consent or skip it altogether, which increases the risk of privacy breaches. Patients in the U.S. also have the right to ask for restrictions on how their information is shared and to see a record of who has accessed their data. In Europe and countries following the General Data Protection Regulation, or GDPR, privacy protections are even tighter. These laws requiring healthcare providers to gather only the necessary data, keep it secure, and get clear consent before processing any personal information, including images. Patients have the right to access their data, correct mistakes, or request that their information not be shared. These regulations are designed to give patients more control over their personal health information. Other countries may have different levels of privacy protection. Some have laws similar to HIPAA or GDPR, while others have less formal rules, especially in places where medical tourism for cosmetic procedures is common. When patients travel abroad for surgery, they might face challenges in ensuring their privacy is protected because legal standards can be weaker or less enforced in the destination country. Follow-up care by doctors back home can also raise ethical questions about maintaining confidentiality and liability. Cultural expectations also influence privacy. In some cultures, patients might expect strict confidentiality, while in others, sharing results publicly or on social media might be more acceptable. Ethical practice in plastic surgery always emphasizes informed consent and respecting patient confidentiality, but how this is put into practice can differ. Practicing plastic surgeons should always get clear, preferably written, consent before taking photos or sharing images. They should have privacy policies that follow local laws, store records securely, and limit access to authorized staff. Patients should be informed of their rights to keep their information confidential and to control how their data is used. This builds trust and ensures ethical care. In summary, while the core idea of protecting patient privacy is shared worldwide, the legal rules and cultural expectations vary. Surgeons need to be aware of and comply with local laws like HIPAA or GDPR, always obtain proper consent, and respect each patient's rights. When traveling for cosmetic surgery, patients should understand that privacy protections depend on the country's regulations, which can add complexity. Always consult qualified healthcare professionals to get personalized advice and ensure your privacy is safeguarded throughout your cosmetic journey.